Hey folks, I'm Dr. Gabe Rodriguez and I practice concierge medicine in Helotes, Texas. This month's medical minute will be on gastroesophageal reflux disease, or GERD. This is also known as heartburn, acid reflux, or acid indigestion. I'll start with the basics, move on to risk factors and prevention, and end off with treatments, all of this in about 3 minutes. The basics. About 40% of adults in the U.S. experience reflux symptoms. Of this, about 10% can develop Barrett esophagus, which is a risk factor for adenocarcinoma of the esophagus. Genetics does play a role in GERD. GERD begins when acidic stomach contents make contact with the mucosal lining of the esophagus at the esophageal gastric junction. Also, transient lower esophageal sphincter relaxation tends to worsen GERD symptoms as the acid in the stomach moves up into the esophagus, causing a burning type discomfort. What are some risk factors for GERD? Well, foods that are spicy, high in fat, or acidic increase GERD symptoms. Caffeine and alcohol and tobacco. Also, medications such as nitrates. All of these can cause lower esophageal sphincter relaxation and thus worsen GERD-like symptoms. If you're obese, if you have a hiatal hernia, or are pregnant, all of these are also risk factors for GERD. A hiatal hernia is a condition in which part of the stomach pushes up through the diaphragm muscle. This worsens GERD because there is a trapping of acid in the hernia sac and there is impaired acid emptying. How can we prevent GERD symptoms? Well, they can be prevented by decreasing the consumption of food and beverage triggers such as spicy or fatty foods or alcohol, or if you take in a lot of caffeine. If you lose weight, you can prevent GERD-like symptoms. Also, if you avoid lying down after eating a meal, if you cut down on your tobacco and on your alcohol use. Also, if you elevate the head of the bed at night, or if you avoid meals close to bedtime, all of these can decrease your GERD symptoms. What are some treatments for GERD? Well, lifestyle changes are first-line treatments, such as the elevation of the head of the bed that I described earlier. If you avoid meals 2 to 3 hours before bedtime, avoid stooping, bending, and tight-fitting garments during and immediately after meals, avoid medications that relax the lower esophageal sphincter. If you lose weight, also cutting down your tobacco and alcohol. First-line medications are H2 blockers. These target histamine, and the result is that your stomach makes less acid, which cuts down on heartburn. Good examples of H2 blockers are Pepcid and Zantac. Proton pump inhibitors are also good first-line agents. The proton pump inhibitors block the enzyme in the stomach wall that makes acid. Good examples of proton pump inhibitors are Nexium and Prevacid and Protonix. I suggest that if you're having to move on to second-line medications, you should probably consider an endoscopy because there could be more serious pathology causing your symptoms. That's all I have for today, folks, on this month's Medical Minute of gastroesophageal reflux disease. Thanks for listening. Take care and be well. Remember, your health is your greatest wealth. So long.